No drug allergy.
How about food allergy?
Food allergy, no.
Okay. The questions I was about to ask after this is can be quite personal. Would that be okay for you?
Yeah.
Okay. Um, may I know if you're currently expecting a child?
Not really. My son is 7 years old. No, I'm
Okay.
not expecting. Yeah.
Okay. Do you happen to be a smoker?
No.
Okay, that's good. Um, how would you describe your working conditions?
Oh yeah, quite stressful, very busy. I'm a full-time working mother. Recently I got a promotion also. Mm.
See. So, according to the information that I have obtained from you, as because your constipation has lasted more than 2 weeks, so I would have to refer you to a doctor because it might be more serious than you think, and hopefully he can prescribe a medication for you. Okay.
Mm. Okay.
Um, for now, I highly advise you. It's good that you already increase your fluid intake, so it must be at least 2.5 liters per day, and
Mm.
you take fiber fiber rich fiber meals. But but I also highly suggest you to take more fruits and vegetables because fruits and vegetables can relieve the constipation.
Mm.
And another thing that you should know is that stress can actually trigger the constipation as well. So I highly recommend that you do any stress relief activities such as exercises. Exercising can really improve your condition. Yeah?
Okay.
But I'm sorry to say that I have nothing suitable for you right now in the pharmacy. So I just have to refer you to a doctor. Yeah.
Sure.
Okay. Do you have any question?
No question. Thank you.
Okay. So that is all for me. So if you have any issues or any questions, you can always come back to the to here and or call us. Yeah. Thank you.
Thank you. Hi, Izati, some quick feedback. Yeah, so it's good, smooth, and then you stay composed and calm. But my picky point will be uh too too much of because the time management. When you ask saying that you want to refer me is almost six minutes already in the real Oscar, then you will be removed from the station, so you will not be able to score the most main part. This one actually, yeah, it's more than 2 weeks, but there is no triggering factors for or alarming symptoms. For example, blood in the stools or pain while passing motions. Mainly it's because the diet. I'm not taking a balanced diet, no fiber, no much water. So you can recommend all types. You can Senna, the bulk lecithin, for example, the silent herbs, lactulose, bisacodyl. And then if you feel like it is, you can always end it with after trying this medication, still not working, then they should go and see doctors after 3 days. Mm. Okay. So take notes. You practice well already. It's just that you need to make sure you compress your counseling, your when the responding to symptoms part. Okay. History taking, that one you need to compress a bit. Okay. Because once you need to end it, like for example, 4 minutes, so that you have at least 2 minutes to talk about the medications. Okay. We will have one debriefing as well. Okay. It's good. I see you later. You can leave the room now. Thank you. Cheers. Can you on your video also? Yes. Are you ready?
Yeah.
You have 6 minutes, huh?
Okay.
Hang on.
Cool.
You want to the question is suppose you already have it. If you want, I can switch it on here just in case. Okay, let's start.
All right. Good morning. I am Izmi and I am the pharmacist on duty today. How may I help you?
Yeah, hi. Yeah, I'm glad to talk to you because I have this constipations. Can I get some medications to ease my constipation, please?
All right. Before we proceed, may I take some of your time to ask a few questions and let me assure you that all information will be kept private and confidential.
Sure, thanks.
All right. May I confirm your full name and age?
My full name is Monica Ang. I am 33 years old.
All right. So may I know when did the constipation start?
Start almost 2 weeks ago.
2 weeks ago. May I know how many days in a week do you usually pass your stool?
Usually I have it every day, usually morning. But with this constipation, I only have 1 or twice a week of emptying my bowel.
Once or twice a week. Twice a week. May I know if you experience any hard stool or bloody stool?
Stool is hard, but I see any blood or mucus.
All right, hard stool. Do you have any other medical conditions?
No.
No other medical condition. Is there any recent change in your diet?
Yeah, that's a good question because I recently got a promotion and then I'm not eating regularly. Yeah.
Not eating regularly. Do you usually take foods rich in fiber?
Not this not recently. Yeah, because of my busy schedule.
All right. Do you drink plenty of water?
No, that's the part I should do. Yeah.
All right. Not drinking plenty of water. Do you happen to be stressed, maybe from work?
Yes, I do feel stressed.
Stress. Are you currently taking any other medications
No.
or any herbal supplements or vitamins?
No.
Do you take any medications in the past to help you with your condition?
Not yet. That's why I want to get something from you.
All right. May I know if you are allergic to any medications?
No.
All right. So sorry, this might be sensitive. May I know if you happen to drink alcohol?
No. I'm not an alcohol drinker.
Oh, all right. Sorry, this is also sensitive. May I know if you happen to be pregnant?
No.
All right. All right. Can you give me a moment to check my references?
Sure.
All right. Thank you for your patience. According to my references, the probable cause of your constipation might be due to not enough taking foods rich in fiber, and you're not drinking plenty of water. So you need to improve your diet.
Yes, I agree.
And based on all the information you have given me, unfortunately, there is nothing in the pharmacy that I could recommend to you. And I suggest you see a doctor immediately because your constipation has occurred for 2 weeks already.
Okay.
All right. So I would advise you to drink 2.5 milliliter of water daily to get hydrated. Please consume diets rich in fiber, as I've mentioned already, such as wholemeal cereals, fruits, vegetables, fresh wholemeal bread, so that it is easier for you to pass the stool. I also recommend you to exercise regularly for your health. And since you
Okay.
are stressed, I advise you maybe to relax your mind from work sometimes. Don't stress too much on your work because it might worsen your condition.
Mm-hmm. Yeah.
All right, do you have any other questions to ask?
No.
All right, thank you for your time and have a nice day.
Thank you. Timing is just right, just 6 minutes. Any particular reasons apart from 2 weeks of not giving any medications?
I thought if refer, no need to suggest medication.
But actually, in this case, it's good to give something because it's because change of the lifestyle. So something is,
Oh, okay.
unless it's a blood or pain. I didn't say I have blood. I didn't say I have pain, isn't it?
Is there?
Mm.
Yeah,
Yeah, tell me a reference. Go ahead.
Yeah, I thought if reference, no need to suggest medication.
Oh no, this one no need referral because it's still not complicated one unless if they see blood, if they got which is linked to this one or weight loss, blood weight loss, or anything that will affect their vital signs, for example, blood pressure, fever, then yeah, can go and see doctors now. This one you can recommend anything, Senocot, lactulose, even the psyllium herbs, okay, even the bisacodyl, okay.
All right, doctor.
Apart from that, I see a lot of improvement in your Oscar. Well done, Isni. So keep it up. The timing you need to. I think this one is okay, but if you give medicines, you need to counsel medications also. So make sure that you have sufficient timing. Okay. Okay, then we will have a debriefing later on. Okay, you may leave the room now. Thank you.
Thank you, doctor.
These constipations, yeah, can you recommend some medication to ease my constipation, please?
All right. But before that, would it be all right to ask you a few questions regarding your condition?
Sure.
Just to confirm, may I know your name and your date of birth, please?
My name is Monica Ang, date of birth 1st September 1988.
Right. And may I have your IC number, please?
456754.
All right, thank you. Can you describe a bit more about your condition?
Just usual constipations. I was not able to go to toilet regularly as before for the past 2 weeks.
All right. So when was the last time you had a bowel movement?
I think 3 days ago.
3 days ago. Do you experience any other symptoms, maybe vomiting or fever?
No vomiting, no fever. Yeah.
All right. And sorry to ask, have you noticed any blood in your stool?
No blood in the stool.
All right. Have you taken any medications to or supplements to relieve your symptoms?
Not yet. Yeah.
Right. And just to confirm, do you have any other medical conditions at the moment?
No.
May I also ask a few questions about your lifestyle?
Sure.
Has anything been changed recently?
Yes, I recently got a job promotion, so my work become more busy. So I'm not able to eat regularly. I'm not drinking water as much as well.
May I also know, is your usual diet rich in fiber?
My usual previously one, yes, but now I'm eating not so much fiber as I should.
All right. If you don't mind, may I also know, do you experience stress on regular basis?
Yes.
Okay. And sorry to ask, but may I also know if you're currently pregnant or breastfeeding?
No.
All right. Thank you so much for answering my questions. So just to summarize, you have been constipated for two weeks, 14 days, and you're not experiencing any other symptoms.
No.
Is that correct?
Yes.
Okay. So I can actually recommend you a medication called Isfagula husk. You can mix one sachet in a glass of water, and then take it twice daily in the morning and in the evening after you eat. But it may take several days to work. And you also need to drink a lot of water when taking this medicine. Would you like to proceed with this medication?
Yes, please.
All right. But in the meantime, as I mentioned before, it may take several days to work. I would advise you to drink more fluid, more water, about 2 liters per day. And you also mentioned regarding your diet just now, maybe try to increase your daily fiber intake. Usually for women is at least 25 grams of fiber a day. So you may try maybe 2 to 3 servings of fruit or half cup of leafy greens like spinach. And do you exercise regularly?
Yes. But now no time. Yeah, very busy.
Oh yeah, okay. So maybe try to incorporate regular exercise, or at least 30 minutes of moderate exercise like jogging, as it can improve constipation symptoms. And since stress can also cause constipation, you might want to do activities that you like to reduce your stress. All right. So do you have any other questions for me?
Yeah, I think okay. Yes, I'll try the medicines that you have mentioned.
Okay. Thank you for coming.
Thank you. Okay, it's good job, Mustaza. I think they flow very well. Keep me very well informed of the medications. You cover most of the thing well. So and then the choice of medications also, yeah, very safe profile. So it is they can take it also, and you have mentioned when it will start on onset. Case overall very good. Well done. We will do one debriefing later. Okay. But did you say that you mentioned how often I should take this one? The salient,
You mean the
the
medication?
frequency. Yeah.
I did mention take twice daily.
Okay. Twice daily, yeah. Okay, with
Yes.
water. Okay, it's good.
All right.
Okay then. I thought you may leave the room now. Thank you very much.
Thank you, doctor.
Thanks. Hi, good morning. May I talk to the pharmacist, please?
Good morning. I'm Rhoda, the pharmacist in charge for today. How may I help you?
Yeah, I'm having some these constipations which really trouble me.
All right, miss. I can help you with that. But before that, may I have your name and your age, please?
My name is Monica Ang. I'm 33 years old.
All right. Okay, I would like to ask you further questions about your condition, miss. Would that be all right with you?
Yes.
Okay. Miss, can you tell me more about your constipation?
My constipations mainly, I can see that my stool is small and hard. Once I can only go to toilet like once or twice a week.
I see, I see. So how long have you been experiencing this constipation?
For the past 2 weeks.
Okay. So now, so when you go to the toilet, do you have to strain?
Yes.
Okay. May I know if there is any blood in your stool?
No, no blood.
Hello, I'm Rhoda, the pharmacist in charge for today. How can I help you? Okay. Good morning. I'm Rhoda, the pharmacist in charge for today. How can I help you? Okay, I can help you with that. But before that, may I have your name and your age, please? All right. I would like to ask you further questions about your constipation. Would that be all right with you? Okay, miss. Can you tell me more about your constipation, please? I see, I see. So you mentioned that 2 weeks ago. Does that mean you have been experiencing this constipation for 2 weeks? Is that correct? Okay. May I know if you have to strain now to defecate? No pain. Okay. May I know if there is any blood in your stool? Okay. May I know if you also experience other symptoms such as nausea, stomach cramp, or bloating? No. Okay. Have you taken any medications to relieve your constipation? Okay. May I know if you take other medications? All right. May I know if you also may I know if you also have other medical conditions such as heart disease or diabetes? May I know if you're currently pregnant or breastfeeding now? All right. Okay, I'm almost done with the questioning now, but I would like to ask you a few questions on your lifestyle now, okay? So now, may I know if there is any change in your life recently, such as a change at your job or your home? Ah, all right, I see. Okay. May I know if you're also drinking a lot of water in a day? Okay. May I know if you used to eat a lot of food containing fiber, such as wholemeal bread, broccolis? May I know if you exercise frequently? Okay. All right. Thank you for answering my questions, Miss. So based on the information that I have received from you, I would advise you to see the doctor since you experienced this constipation for 2 weeks already. But I can also advise you on dietary measures. So I can see that your constipation may also be due to insufficient intake of water and also lack of fiber diet. Therefore, I would advise you to drink a lot of water in a day, at least 2.5 liters per day. I also advise you to eat more food containing fibers such as wholemeal breads, broccolis, and I also would like to advise you to exercise regularly because exercise helps to improve the movement of your digestive system. Okay, and you mentioned that because of your job promotion, it also lessen your time to go to the defecation. Is that correct? Right? And you eat less breakfast as well. Okay, so if you have the urge to go to the toilet to defecate, please do not hold it in and allow the time to go to the toilet, and please do not miss your breakfast as well. And if there is still no improvement after 2 weeks since you change your diet, then I recommend you to see the doctor for a better assessment. And you also would like to take medication, is that correct? Okay. So other than diet, I can recommend you a laxative called Ispacula husk. So Ispacula husk, for this, you can take one sachet twice a day, mix the sachet into a glass of water, stir well, and then drink it as soon as possible. So for this to work, it may take a few days before the laxative takes an effect, and you may need to remember to stay hydrated while taking this laxative in order for it to be effective. And if still, even after 1 week, you still cannot see an effect after taking this laxative, then I would recommend you to see the doctor. So far, do you have any questions? All right, all right. So in that case, I can end it here. I hope you have a nice day, miss. Thank you. All right. Thank you, doctor. Okay. Thank you.
Hello, doctor. Hello, I'm Momo, the pharmacist on duty today. How may I help you? Before we start, may I ask your name and your IC number? Your name, please. Okay. May I also know your age? All right. Is it all right if I ask you a few questions regarding your health conditions? And I would like to assure you that all the information will be kept private and confidential. Okay. So how long have you been experiencing constipation? 2 weeks. How frequent is your bowel action? Okay, thank you. I'm sorry to hear that. Can you describe how your feces looks like? Okay. Have you experienced constipation before this? Okay. Are you experiencing any other symptoms? Okay. Do you happen to change your diet recently? Okay. But is your usual diet contains food rich in fiber? Okay. Do you have any other medical conditions? Okay. Are you taking any prescribed medications or over the counter, such as herbal or supplements? Okay. Have you taken any action to treat your constipation? Not yet. All right. Have you traveled anywhere recently? Um, and how is your exercise? Okay. I'm sorry. I'm actually unable to recommend you any medication at the moment because you have been experiencing constipation for 2 weeks already. So I will have to refer you to a doctor so that the doctor can examine you further and decide on giving you the medication. In the meantime, I will advise you to drink plenty of water, around 2.5 liter per day, and eat foods rich in fiber, such as wholemeal cereals, bread, fresh fruits and vegetables, and also exercise regularly, around 150 minutes per week. Do you have any other questions? Okay. I will refer you to a doctor so that the doctor will examine your condition further, and give you a medication. Is that okay with you? Okay. Um, yeah, you should. It will be nice. Your condition can improve if you follow the advice that I given to you, which is like drinking plenty of water and eating foods rich in fiber. Uh, Try to do yoga since you said you have been working too much. I would advise you to do yoga or meditation to improve your stress. Do you have any other questions? Okay. Thank you. Thank you. Is it all right if I follow up with you in a few days to ask about your condition? Thank you. It's already 2 weeks. The constipation lasted for 2 weeks, so I think it's better to refer to the doctor. So is it like I advise on the diet and look first for like another 2 weeks and give like recommend the medication and also advise the patient on taking the diet, on changing the diet, and then look first? Is it like that? It's popular. Because in Dr. Hui's slides, it says if dietary changes didn't work after 2 weeks, then refer. And the medication also. After 1 week, if it didn't work, then you refer. So it's like that. So it doesn't have to be refer straight away if it's 2 weeks. Doctor. Thank you, doctor. Do we ask traveling details in this case? But we still ask first. Thank you, doctor. See you, doctor. So I leave.
Yeah, okay. Good morning. My name is Jasmine and I'm the pharmacist on duty today. How may I help you? Oh, I see. May I know your name and your age, please? Okay, thank you. Before I can proceed to your constipation, will it be all right if I ask you some questions first? Okay. When do you usually go to the toilet to pass your stool? So with constipation, how often do you go to the toilet?